Well, good evening, everyone. My name is Carolyn Curtis. I am the CEO and founder of the Carup Company that has been in existence for some time. My goal with the Carup Company is to really address the maternal mortality crisis that we have in the United States amongst all women, but I'm paying particular attention to Black women. I am going to tonight share with you about my coaching program I have developed in a way to really help families as they prepare for pregnancy, whether they're currently pregnant or planning to become pregnant in the next year or two. And so I am going to have a great presentation to give to you. I'm going to hide a little bit behind the presentation. I'm going to bring that on. Please feel free, wherever you are joining from, to provide information on the chat. Please feel free to your comments in the chat. And once I am through with the presentation, I will be very, very happy to go over any questions or comments that you might have. So again, thank you so very much for joining with me tonight. So let's take a look now at Mastering Pregnancy and Birth program. My slides want to do their own thing, so let me come out of the frame for a second and work with these slides. Okay, so again, here we are. My background, I am a nurse midwife. I have been a midwife since 1979. I've had the privilege of taking care of many families. I've worked in clinical practice, seeing women throughout pregnancy, labor, birth, postpartum period, as well as caring for women for family planning and also for GYN care. I have directed midwife programs in public hospitals. I worked in both the public and private facilities. And I've also done about 20 years of international health where I have been overseeing numerous types of family planning and maternal child health programs in a number of countries around the world. Very, very exciting work that I totally love. What I want to do is to review with you what we're going to cover tonight. And what we're going to cover is making sure this is showing. What we're going to be covering tonight is going to be looking at maternal mortality in the United States, looking at the healthcare system and helping everyone to have a sense as to what are the options that you have as a childbearing family. What are those options available to you that are safe options? I also want to look at what's happening with insurance and also maternity and paternity leave to ensure that everyone has the opportunity to really know what their insurance covers. A lot of times it may cover more than what you think. And what I know about insurance companies and having worked as a provider for HMOs that took Medicaid as well as private insurance is that there are a lot of things available to you that your provider may or may not tell you about. And keep in mind that the insurance company also wants to tell you necessarily all the benefits that you might have, those being home visits during pregnancy and also after you've had your baby. And after we look at all of these things, the question is, what is it that I want my pregnancy and my birth experience to be like? And so let's take just a few seconds right now. I'm going to stop talking And I'm going to ask you to take a few seconds to really look at what is it that you want your birth experience to be like. Let's take a few seconds and jot down those ideas. Just whatever comes to your mind, just jot it down. It can be fantasy, it can be what you've heard other people have, what you may not want if you've had a baby before, that you might want something different. So let's take a thought about that. Let's think about that a little. I'll throw out some things. Ever want aromatherapy? Candles? Some women would love a water birth. Different positions that you may want to have your baby. Just some things to get your thoughts moving. Okay, let's move on. Let's get a little bit into the idea of what is maternal mortality. What in the world does that mean? And we hear this term thrown around, but what actually does it mean? And what it means is that for every 100,000, it's the number of women who died for every 100,000 births. And they would have died up until your 6-week appointment, the 6-week appointment, that first 6 weeks. That's what we mean when we're talking about maternal mortality. Now, let's take a little look at what is the maternal death rate in the United States for women of color. And I'm going to share with you if we do have some further information for 2022 as well. But what you're going to see for the most part, and what I want you to get, is that overall, even for the overall population, since 2018, there has been a doubling of the number of women who have died during childbirth and up to the first 6 weeks. When we look at this for whites, it's almost doubled from 14.9 to 26.6. When we look at blacks, it's also almost doubled. And when we look at Hispanics, it has more than doubled. But the thing to look at is look at the comparison of whites to blacks and whites to Hispanics. What you're going to see is the comparison between whites and blacks is almost 3 times what the death rate. When you look at whites to Hispanics, it is almost the same. The other thing to take a look at is when we look at the age of when women are dying, there is a big difference between, again, 2018 is the number that's on the blue, and then 2021 is what's in the kind of a purplish color, the last column on the right. Again, what you're going to see is pretty much a doubling for those that are under 25 between 2018 to 2021, a doubling for those that are 25 to 39. And then when you look at women who are 40 and over, wow, what a big, big, big difference. We are seeing that if you are 40 and over, that you are about 7 times more likely to experience problems with maternal mortality than for someone who's under the age of 25. If you were to look at those women who are 25 to 39, what you're going to see is that that is going to be about 1.5 times. So a big, big difference between the ages. We did know that once you were 35, that your risk of not so much maternal death, but your risk of having a baby with any kind of genetic defects was higher. But now what we're seeing is that once we move into age 40 and over, having children, we are at a much greater risk for having maternal death. The question now is, when are mothers dying? And what we're seeing is that mothers are dying 47% within that first week after they've had their baby, the first week. And then 53% of mothers are dying from that first week up until baby's birthday. So even though we may have had a safe birth, there's still a lot of observation and care that needs to be provided to mom in those first weeks after she's had her baby. And this is where it's important to look at the need for home visits and to just see what is going on with mom. Why? What are the reasons? Well, the main reasons for maternal death, I was really surprised. Mental health is 23%. And what we also know is that we have 5 main reasons, and that all of these things can be prevented, all of them. Hemorrhage is the second largest area for maternal death. Cardiovascular, which includes high blood pressure, preeclampsia, eclampsia, all of that is cardiovascular. About 13% of maternal deaths are caused by that. Cardiomegaly is when there's an actual defect in the heart itself, in the heart tissue, and that is causing 9%. And then blood clots are in there, 9% as well. How are you guys doing? Okay, as we move on, everything's okay? I wanted to bring up some examples to make this a little bit more personal. We can talk about numbers and paper and all that, but when we start knowing who these individuals are, I wanted to share what some of those reasons for their death were. And when we can start to personalize this, it makes a difference. Now, Tori Bowie was a picture of health. She's an Olympic athlete, and she died at the age of 32. And the reason that she died, one is when I look at some of the write-ups around Tori, it seemed that she did not really trust the healthcare system. And we're going to have reasons as to why Blacks have issues trusting the healthcare system. But she was found dead at home. And it was thought that she died from eclampsia, which falls into that area of cardiac. Okay. The next person, we all heard about Serena Williams. Well, this is an example. Cardiovascular as well, is she had experienced blood clots previously in her life, so she knew what the signs and symptoms were. And after she had her baby at the age of 35, this was her first birth, she experienced all of the shortness of breath. She knew that something was not right. She had to plead. The nurse ignored her. And she's pleading, like, really, like, I know what's going, this is not it, this is not right. And what was found is that she was experiencing a blood clot to the lung. The medical term for that is pulmonary embolism. My mom experienced that after she had surgery, and my brother. So I have a family history myself of that. Beyonce, after at the age of 36, Beyonce had her twins. She experienced preeclampsia, and she was on bed rest for a number of weeks during her pregnancy. But she did experience preeclampsia. Again, that falls into the cardiovascular disease area. Kira Johnson. I don't know. Her case was heard a lot about. She had complications from a planned cesarean section. This was her second cesarean section. She went in totally fine. She was the picture of health. The cesarean section itself went fine, had a beautiful little boy, but it was in the recovery period is where problems arose. Her husband was there with her, and what he noticed was there was blood in her Foley catheter tube. And he was thinking, this is not right. Like, why is there blood in her Foley catheter tube? And he asked questions. She was to have an MRI done stat. Stat is immediate. Time went by. He kept asking, no, nothing happening. He was actually told by the nurse that she wasn't a priority. Meantime, she got blood in this urinary catheter. And the other thing that he was concerned about is here he is a Black man, and how can he advocate for his wife in a way that it's not going to end up being retribution towards her, where they're not going to take care of her as they need to. So he was straddling that issue. By the time she went back for her cesarean sect, went back to find out to basically, she went back for another surgery. She had bled 3.5 liters of blood into her stomach. 3.5 liters. She died on the table, 39 years of age. Once again, this was after 8 hours. Here her husband is advocating for her, and they're not being listened to. Let's look at some problems that women of color face in the healthcare system. And this is not Carolyn Curtis talking. This is written up, documented in studies. Those things say that there's a lot of racial bias. Health providers have their own racial biases. They don't want to listen to women in regard to what their birth preferences are. African Americans are the least likely to be listened to and often are dismissed. They don't listen to moms about what their preferences are for their birth. The other problem is that there is a lack of Black and brown providers in the healthcare system. Black women would like to have somebody that looks like them, expressing a preference for that. There was an 11-year analysis done of more than 9 million, yes, 9 million hospital births. And what they found was that Black women had a 53% higher risk of dying in a hospital setting during childbirth. 53% higher risk. Again, this is not Carolyn Curtis talking. This is what the literature is telling us. And this does not matter about the woman's income level, her social status, her insurance type. That doesn't matter at all. None of those things factor into that. There was also another study that looked at what women face. 17.3% of women talk about having one or more types of mistreatment occurring. That being feeling that they no longer have a voice, their loss of autonomy, their loss of self, a sense of self, that they get lost in this system. Women are shouted at, women are scolded, threatened, ignored, refused, receiving no response when they ask for help. The study also showed that it depends on where someone has their baby, that it is a difference depending on where. Women who deliver at home have a much lower risk of being mistreated than women who are in a hospital. 28.1% of women in hospitals report mistreatment compared to 5%. That's almost 6 times the amount of mistreatment going on. And the factors that were associated with being mistreated included if they were having a vaginal birth. Actually, I'm saying factors that gave a lower possibility of mistreatment. Excuse my error there. If they were having, like, say, in a birth center, community birth, like in a birth center or at home, if they were attended by a midwife, if they were white, they did not have this level of mistreatment. If they had had babies before, so women going in with their first babies are experiencing more mistreatment than women who have had babies before. And that's likely because they've got a little bit of experience with this healthcare system and they know and can say more of what they want. Women who are older than 30 years of age. So our younger women face more problems with mistreatment. I took care of teenagers for quite some time, exclusively teenagers. And with my colleagues, it was a group of midwives. We made sure that we were at the hospital before they ever arrived when they came in for labor. Basically, so that we were there to make sure that they were covered. Now, let's take a look at different types of health facilities. This course is going to help you to understand the safety and the cesarean section rate. But this is a question that I want to throw out. A lot of times when women choose where they want to have their babies, where do they get that idea? Why did they choose that particular hospital? What do you think? You can, I have one person on right now. Feel free to communicate with me. We can have some conversation as I go through this. A lot of times women are choosing to go to the particular facility because their girlfriend may have gone there or a family member may have gone there. They may have had a referral from someone. But the question that I'm going to ask is, are they aware of what the cesarean section rate is like at that hospital? Are they aware of whether or not it is a baby-friendly hospital? Most likely not. And this course is going to help whoever is taking it to be able to look up hospitals to see what is the safety record, also to find out the cesarean section rate of those hospitals, whether or not they're baby friendly. These things are important in terms of deciding where you want to have your baby. You may have a hospital that is in care, or I know, like, I'm in Washington, D.C. We have a number of teaching hospitals here, and some are well known for that's the place to go if you've got trouble with your heart. But is it the place to go to have your baby? That might be another question. I'll give an example. My family lives in Southern Maryland. That's where I grew up. And near our family home, there are 3 different county hospitals. And I was able to look up. Okay, Tiandra, how are you? I'm so glad you can join in. Thank you. But the story I want to share is I looked up these 3 hospitals, and these 3 hospitals, no matter what direction, they were in 3 different counties. So I could go to either one. Okay. I could go to my own county hospital, or I could choose to go to one of the other county hospitals. I looked at the cesarean section rate, and guess what? One cesarean section rate was 27%. Another one was about 32%. And the hospital that I thought was the best hospital of those 3 counties, their cesarean section rate was 42%. What does that say to me? That says to me that the likelihood of me getting an unnecessary cesarean section is going to be higher at this hospital that's doing 42% of the births there are cesarean sections. So I might want to go someplace else. But the other question to ask is, how far are you willing to travel to get the kind of care that you want? If you go 30 minutes longer, you would be at one of the top hospitals in the United States when it comes to childbirth. And so, because of where we live in Southern Maryland, if we want serious medical care, we have to come to Washington, D.C. And that's a minimum of an hour drive. We're used to that. And so that is the question, is how far are you willing to travel? In my initial job as a midwife, I worked in Philadelphia, and we had people traveling from Maryland to come to the site that I worked at because of the reputation of that facility. So people will go where they want to go for healthcare. It's just taking a little bit of time to research some of this information and being able to know. So this course is going to help you to identify where are the hospitals close to you, what are their overall safety records, and also what's the cesarean section rate of these hospitals? Are they baby friendly? Okay. Now, the consent forms, I'm going to say, being careful about consent forms. My question is, do you really understand what you are signing? We're also going to look at insurance and parental leave. Let me back up for a second. Let me see. I want to go back a little bit to consent forms, because this course is also going to, oops, I don't think it's going to let me go back. But anyway, going back to consent forms, this course is going to help you to know how to look at and understand what is in the consent form. In my work as a midwife, I was responsible for admitting patients to the hospital. We were in the public hospital in Washington, D.C. We did not have a clerk who was going to sign all these consent forms with the patients. And so it was the responsibility of the person admitting the patient to have them sign the admission forms for labor and birth. And I always recommended that they did not sign the consent form as a part, like I never wrote in cesarean section in the general information within that consent form. And we'll get to this in the course, is going to look at what are the components of informed consent, so that you know what you are signing, you understand what you are signing. And I would always say that there is enough time for someone to come and talk with you, explain to you what is going on, for you to understand why is there the need for a cesarean section. Again, I have worked clinically as a midwife over 24 years in hospitals. I know what happens. And I know that I can count on my two hands, sometimes maybe one and a half, how many times you had to go rushing, busting through the door to do a cesarean section. Most times it's, well, let's kind of see what's going on, and we'll come back and reevaluate and reassess. Well, while they're doing that, they can be explaining to you what is the concern, and there is time to sign for cesarean section. It's rare that you have to go busting through the doors and it's such an emergency that there's no time to talk to you. I find it interesting that you have to sign a separate form for anesthesia if you're going to have epidural anesthesia. They come up, they talk to you, and you sign that form separately. And so I always recommended to the patients that I admitted is that just hold off. There's no rush to sign a consent form that includes cesarean section as the general care that is to be provided during labor and birth. I want to now talk a little bit about leave, and where this course is also going to touch upon this. It's assumed that there's maternity leave, right? We assume, okay, we have maternity leave, but that's a major assumption to make. Um, the course is going to have you explain this a little bit more about the Family Leave Act, what that means, but also to help you make sure that you understand what leave you have. We do know that persons who are working in jobs that are making $14 and less per hour likely may not have any leave at all. They may not be storing up leave. I also know that a lot of companies will hire people just up to the number of hours you need to work so that they don't have to pay for benefits, right? I know that that's reality. And so people may think, okay, I have maternity leave and may find out that they don't. Even paternity leave for dads. Dads want to be at home when these babies are born too. And we need to see what exactly is what. And so this course is going to help families to have a good sense as to where are they. And it'd be great if this course is taken by families prior to becoming pregnant so you can prepare for that scenario. That when it comes time for baby's birth, that you're good. You know what you have. You know exactly what you have. We're also going to touch on the need for emergency funds. There are many times when I've cared for women that I have suggested that they might need to try to stop work, or actually, I encourage women, if it's at all possible, that they stop work before the due date, a week or two before. But the reality is, most women are not able to do so due to the financial status of their family. And so, this course is going to allow family members to take a look at their finances and look at, okay, what do I need if I need to be off a day or so? There are also other times that I have actually asked women, due to what is occurring with them in their pregnancy, for medical reasons, to take off work because of complications that are brewing and trying to raise their head. I would say it's important, if you can take off, you need to be off, you need to be resting. And we do know the reality is that if there are financial pressures, you do not feel that you can take off work. And with all that's going on now under this administration, that pressure is probably going to be even more for those who are working. All right. We know that lack of insurance, I talked and mentioned. We do know that in the Black community that there are fewer women with insurance than white women. It's not a major difference, but it is a difference. 89% of Black women have insurance compared to 93% of white women. However, if you're in that 11% of women who don't have insurance, this is going to be a major gap. And the other, again, is understanding the type of insurance that you have and what it actually covers. And the course is going to help you to look at your insurance coverage so that you know exactly what's covered, what is not covered. As I mentioned to you, home visits can be covered by insurance, but providers are not going to bring that up to you and say, oh, by the way, let's arrange for home visits for you during your pregnancy. That doesn't happen. That does not happen. And so, if you know what your insurance is able to cover, you can ask for that and get that. We do know that home visits make a difference, both prenatally and in the postpartum period, particularly in those first couple of weeks after you've had a baby. 43% of women are dying in the first week after they've had their baby. That is when they really need these home visits, as well as prenatally, to get ready. Okay. So a lot of times insurance covers it, but they don't even tell you. And maybe the provider themselves don't know. So it's important for you to know your own insurance. And you can say to your provider, can you order home visits for me? So, because if my insurance covers it, then take advantage of what your insurance provides. So I'm putting all this out here, and I'm just going to say it does not have to be like this where we're at a facility that has a high cesarean section rate. We're at a facility that is not safe or has staff that are not responsive, because those safety reports actually tell you about non-responsiveness of staff. They evaluate that as a part of safety. We do not have to be in facilities that are not going to try to help us meet what we are interested in having for our birth experience. I do want to say that I'm realistic. I've worked with families that have had incredible birth experiences. And I've also worked with families where we had the whole 9 yards: Pitocin induction, cesarean section, all the problems. Okay. I've worked with all of these families. And I do know that it is possible to reserve some of the things that that family wanted in their birth plan, even if I have a Pitocin induction, even if I have cesarean section. It's possible to still meet some of the things that are really, really important to families. Again, I'm going to go back to the question: what do you want your pregnancy and birth experience to be like? That's the question. And I'm going to say it can be yours. It may not be 100%, but a lot of it still can be yours. And I want to help families to have positive experiences as much as they possibly can. With Mastering Pregnancy and Birth, it is a coaching program that I hope at the end of the 4 weeks that families feel more empowered to take control of their health because they understand their health. They understand their health risks. And so once what you will be doing as a part of the program is really looking at your own history, looking at your own health history, looking at the history of your family. And we know the 5 major reasons why women have died or caused deaths during childbirth. My goal is to help you know what are your risks compared to those, and how can you reduce the risks. To help you know, you can choose your health providers, and I'm going to say safe on top of that. I'm very much on making sure it is safe, that I can choose a safe location for the type of birth that I want. And that is going to go back to understanding your health risks. Okay. I'm not going to make recommendations to be in unsafe birth locations based upon your health history and what occurred with you during pregnancy. And that you can make, when I say deliberative, informed decisions, meaning that because you know your health risks, because you know your family health, because you um, are having a voice around the type of health providers around you, because you're making informed decisions about where you want to have your baby, that you feel that you are the one. You can make these deliberative, when I say deliberative, on purpose. It didn't just fall in my lap. On purpose, I made this decision, and I know exactly why I made this decision. That it's informed. It's informed based upon what you know about yourself, what you know about your family, what research you did on these particular birth locations, birth providers. You've done your homework. So therefore, you can say, yeah, I made on purpose. I decided I'm going to go have a baby over here. And this is who I want for my providers. I did this on purpose because I've done my homework around this. And this course is going to give you the tools to be able to know all of these things so that you're able to make those decisions. What are you going to learn in this course? This is what's inside of it. It's 4 modules. expanded over a 4-week period of time. 11 lessons. In the first module, which is the first week, you will learn your health history and your family health history. You will know what are your health risks based upon having collected that information, which means that you're going to need to sit down with your family, sit down with your mom, and get her to tell you everything. Okay. Um, and also for your own health, you are going to know that. And based upon that, you will be able to identify do you have any health risks at all? Are these health risks that may apply to those 5 root causes for maternal death that we know or we've seen? Um, are you going to have any, can you have any problems that can creep up during pregnancy or during the post delivery period? You're going to be able to validate your body mass index. This is the first one. And based on that, a lot of women say, how much weight should I gain? The body mass index will be the measure for how much weight you should gain in pregnancy. And so what I can look at anyone now, but I can't say, oh, your weight should be X and your weight should be Y. It's based upon your body mass index. And also you will know all of this by the end of the first week. Okay. The second week, we're going to now move into insurance for pregnancy and for you're looking at maternity and paternity leave. Did you know that if you don't have adequate insurance, that it's possible you could be eligible for short-term disability? And short-term disability, let's say if you got hurt on the job, a lot of times insurance would not kick in for 90 days. But if you had short-term disability, something that you can buy yourself, or some jobs, if they don't offer health insurance, they may offer short-term disability. You may not know it, and they're not going to tell you, okay? But it's something for you to ask about. So by the end of the second week, you will have a much better understanding as to your insurance. If you have a family budget, that is fantastic. If you don't, now's the time to start, because you want to put away emergency funds, funds that when the rainy day happens, you can pull on those funds. And particularly with all that's going on in our country right now, there is certainly the need for this. Once again, you will know your maternity and paternity leave. I have a form that's there that if you have not been keeping this for yourself, I would suggest that you begin keeping this information on your own and not waiting for or having your job tell you what you have. You know how much you get every pay period, and you can plug that into this form that I have. You will then be able to determine how much you need to have by the time the baby arrives, so that you can take the necessary time that you desire. This will be covered in the second module, second week. Third week is looking at all the different types of OB providers. This is going to be looking at health providers and locations for birth. Why did I put insurance first? Because your insurance tells you what type of providers it will cover and what types of locations for birth that it will cover. The last thing you want to do is choose a provider that's not covered by insurance in your state. I'll give you an example. There are 3 different types of midwives, and we're going to talk about that in module number 3. However, only one type is covered in all 50 states: certified nurse midwives. Certified midwives are covered in 11 states, and certified professional midwives are covered in 30, I believe it's 35 states. So no matter what state you're in, if midwives are your desired provider, you want to make sure your insurance is going to cover that particular provider. Otherwise, be ready to pay out of pocket if that is your choice for provider. Just know that up front. And that still might be what families choose to do, and that's perfectly fine. but it's to really know that. We'll also look at the different types of facilities, and I'm going to say safe facilities for birth. We're going to clearly go through that. It's really important while there's the desire and dream to sometimes have home birth or out of hospital birth, depending upon the health history and previous history with previous pregnancies and births, it may not be the safest choice. Okay. And let's be real about that. Um, the goal at the end of a pregnancy is to have a healthy mom and a healthy baby. That is the goal. That's the ultimate goal. And how we get there, different ways of how we get there, but that's the ultimate goal. We'll also be able to know by the third week those facilities, particularly if the choice is for hospital, look at the cesarean section rates. And those hospitals that are, when that question of how far are you willing to go to travel, decide how far you're willing to travel. If it's an hour, hour and a half seems like a lot. But if it's an hour, know what's around you 60 minutes away. And it may provide you with a much broader choice of safe locations. And is it baby friendly? Not every hospital has the designation of being baby friendly. We'll learn more about what baby friendly means in the third module. The fourth module is going to be around now that we have all this information, now we can really write up an informed birth plan. Pregnancy and birth plan is what I call it. And I say informed because we now have our history. We now know what our health risks are. Now we know what type of providers are out there, where and the type of facilities for birth. And based on those things, then we can write up an informed birth plan, which would be, I say that birth plan is also part of informed consent, informed choice, because you are making that birth plan out of the knowledge that you have gained about yourself, the things that you know that you desire. You will be able in your own mind to make decisions about those things being safe for your childbirth experience. Module 5, it's not really a module. I call it Module 5, but it's not a module at all. I am going to allow 30-minute phone call, a personal phone call with me to be able to answer any questions that you might have. And this can be done at any time during the course. It might be more towards the end of the course. Throughout the course, what I will do is once a week have a live question and answer period to make sure that you're moving through the course without any trouble or any difficulties. But this individual phone call is your own phone call. There might be some things, say, around health history that you certainly don't want to discuss in a group situation. You would want to have more of a private conversation around that. And so that would be the opportunity for that. So the question might be, why should I buy this course? Why? Well, this course is going to give you tools that will be available to you, not just something that you learn in this course, but things that you will be able to carry with you for the rest of your life. Once you know your family and your own personal health history, it's not going to change a whole lot until, unless you develop more health issues as you age and get older. But this is who you are. This is your family, and this is your personal health history. Once you have completed this, you don't have to keep doing this every single time you go to see a new provider. You already have this information. And so what you can do is almost hand them your sheet of information or tailor it down to what is required for that particular healthcare provider that you're seeing. So once you have done this process, it's good for many other times that when you go to a new provider, of course, they're going to always ask, tell me your health history, your family history, all of that. Well, now you have it. Okay. The other is that you are going to know for yourself what are your health risks. And your health risks not only for your general health, but how does your health risk compare to what we know to be root causes for maternal death? And also, what are your health risks for the future for your own life? That if we uncover some things that are risk for you now, whether or not it's something that you may want to address prior to pregnancy occurring, or something to address later in life. One big one that I will say is in terms of weight management is really important during pregnancy, because complications can happen when women are very overweight. So that is something to know. Also, knowing what is covered by your insurance. And I'm going to be honest with you, when I sat down to put together this information, we like, okay, I got health insurance, I got it. It made me sit down and look at my own. I'm like, oh, wow, okay, I didn't know that. It will help you to take out the time that you normally don't do because we have busy lives to sit down and really study your health insurance coverage for yourself. Know what type of healthcare insurance you have, know what it covers. Does it require copay? Is it fee for service? All these different things. Is it a health savings account? So you're going to learn these things in this course. And you may, based on the information you learn about your insurance company, you may make a decision to change it out to something different. Or you may need if you've got husband and wife both together, you may decide, do we both need to carry insurance? Or maybe we both do to save money because now it's covering XYZ triple A. You will also know how much leave you have, and you'll know more about the Family Medical Leave Act. Okay, what does that really mean? Just because the Family Medical Leave Act is in place by law does not mean that you have paid leave. We're going to really understand informed consent. We're going to really use that now for this. But once you understand informed consent and what all that means, you're going to use this for everything you need to sign papers for. As my mother would say to me, you never sign anything with a blank line, no blanks. Okay. You never sign anything with any blanks. And this is not only for pregnancy and birth, but when you go to buy a car, okay, when you purchase a home, when you sign for a loan, you will be able to really get into what is this consent form saying, to make sure that you totally understand what you're signing. So this is going to help you not only for childbirth and pregnancy, but also for anything else that you do in your life. And also, once you look at this birth plan that you have put together with all of this knowledge that you have gained in the earlier modules, modules 1, 2, and 3, you will have kind of what you want for your birth. And that will affect this pregnancy and future pregnancies. And so once you kind of have a birth plan in place, there may be some tweaks or something different for a second baby, a next baby. But at least you now have the roadmap for what you want to do, where you want to go. Now, the other is that there will be a private community that you will be invited to join. It will be only those students who have gone through this course. I will let you know that this is a relatively new course, and so you all are getting in on the beginning part. I put a lot of energy and effort into this, and I would be really happy to know how it's going for those who will be joining. I would love to get your feedback to make it even better. Uh, as anyone who creates something, it can always be improved. And so I really would love to get your input and feedback. This course is probably worth more than $1,500. I've put a lot of time and energy into it. And I said, you'll get confidence and new friends. That should be not worthless, but that's a wrong terminology there. I was tired when I did that slide. Priceless. It's priceless to be able to gain more confidence and to make new friends. as you go through this. I know when I taught childbirth classes in my earlier years as a midwife, many people in those classes got to be friends, and they followed each other after they had their babies, and we'd get together after, they've had their babies in the 6-week checkup, and we'd come together periodically, and just so much that you've experienced together. And I hope that's going to be the same way with this course, that you feel like you're experiencing something together. And so you will be invited to a private group. So this course normally is $397. I'm giving 20% off to the first 10 people who would like to provide feedback to me. This is good until tomorrow at noontime. It can be paid as one payment, or it can be two payments. So I'm open to two payments. That's possible as well. So that's the offer. And the other is that there is a 7-day money back guarantee for whoever purchased the course. So if in the first week you feel like, nah, not what I thought, not what I want to do, if you let me know by the 12th of April, the course will start on April 7th. By 5 o'clock on the 12th of April, you will get your money back. So it is a no risk investment. These are the links. I'm sorry, that January 2nd is not quite right. I ran this course in January as well. But these are the links, and there's also the link to the 20% off promo. So that if there's anyone here who would like to purchase the course, I'd love for you to do that. The course, again, will start on Monday at 5 p.m. is when the course will go live. You will have it be presented to you one module at a time. So you will have access only to module 1 in the first week, and then you'll get access to module 2 in the second week, module 3 in the third week, module 4 in the fourth week. But all of that content will continue to be there. At this time, I'm offering that you will be in the program for a year after you have come in, so that all of those things will be available to you, as well as the community, for 1 year after you have enrolled into the course. All right. That's where we are. Any questions at all? Feel free. Any questions? None? Tiandra, none? Anyone else who's on? I'd love to know. There are 2 other people on besides Tiandra. Would you love to make yourself be known? I'm going to stop sharing, then you can see me full. Any other questions? Anyone else? Okay. I want to thank everybody for their time tonight. I know an hour is really precious at the end of the day, but to say thanks for those of you who have joined in. I hope that this is helpful to you to have an understanding about what's inside of the course. You can continue to join up until Monday. The thing of it is that the special is going off. And so if you're thinking about it, you can, get the 20% off until tomorrow. Actually, I'm going to go ahead and extend that to 5 o'clock tomorrow. That gives everyone a little bit more time. But thanks so much. Really appreciate you all. And I hope that you've learned a lot with the webinar. Okay. Have a great evening. Good night. Thank you so much. Good night.